Every single night, while 73 million Americans lie sleeping in their beds, something quiet and dangerous is happening inside their arteries. Not cholesterol, not the molecule their doctor has been warning them about for the past 20 years. Something else entirely, something that begins around 2 a.m. and continues until the moment they open their eyes in the morning. And by the time most people learn what it actually is, they have already had their first cardiac event, their first stroke, or their first stent procedure. In nearly 60% of heart attack patients, cholesterol levels at the time of the event are within what laboratories call the normal range. Let that sit for a moment. More than half of the people who collapse in their kitchens, in their driveways, in their bathrooms at 4 in the morning had cholesterol numbers their physician would have congratulated them on at their last appointment. The cardiologist would have shaken their hand. The lipid panel would have looked beautiful, and then the artery closed anyway. This is what nobody in a 15-minute cardiology consultation is going to explain. Cholesterol is not the enemy. Cholesterol has never been the enemy. Cholesterol is a repair molecule, a healing substance, a structural component of every single cell membrane in the human body. Calling cholesterol the cause of heart disease is like calling firefighters the cause of fires because they keep showing up at burning buildings. The cholesterol is there because something else damaged the artery first. And what damages the artery happens most aggressively while a person sleeps. Subscribe to Dr. Waterling right now and hit that like button. We are working toward our next milestone of 1,000 engaged subscribers, and this channel is built on one principle, that the system makes money when people stay sick, not when they get better. Every subscriber moves the channel closer to reaching the people who need this information before they end up on an operating table. Now lock in, because what comes next changes how a person should think about heart disease for the rest of their life. The arteries of the human body are not passive pipes. They are living tissue, lined on the inside by a single delicate layer of cells called the endothelium. This layer is one cell thick. A barrier so thin that it cannot be seen with the naked eye, yet it covers a surface area larger than a tennis court inside the body of an average adult. The endothelium regulates blood pressure, controls clotting, manages inflammation, and decides moment by moment whether the artery stays open or begins to narrow. Everything that happens in cardiovascular disease begins with damage to this single layer. Here is what happens at night, and here is where the picture becomes uncomfortable. Between the hours of 2 a.m. and 6 a.m., the body enters its deepest metabolic shift of the 24-hour cycle. Cortisol, the body's primary stress hormone, begins rising sharply around 3 a.m. in preparation for waking. Blood pressure, which dropped during deep sleep, begins climbing again. Blood becomes measurably thicker because the person has not consumed water in 6, 8, sometimes 10 hours. Platelets become more sticky. Inflammatory markers rise. And in someone whose metabolic health is already compromised, blood sugar quietly elevates during these same hours, a phenomenon endocrinologists call the dawn phenomenon. Now imagine this scenario. A 62-year-old man eats dinner at 7 p.m. A typical meal of pasta with sauce, a piece of bread, a glass of wine, perhaps a small dessert. By 10 p.m., his blood sugar has spiked and is just beginning to normalize. He goes to bed at 11 p.m. From 11 p.m. until 7 a.m. the next morning, his arteries are bathed in elevated insulin, residual blood sugar, inflammatory compounds from the wine, and a thickening pool of blood that becomes more concentrated by the hour. His blood pressure climbs in the early morning hours. His cortisol surges. And the delicate endothelium lining his coronary arteries, the arteries that feed his heart muscle, takes microscopic damage hour after hour, night after night, for years. That is the mechanism. That is what actually clogs arteries. It is not the cholesterol on the dinner plate. It is the chronic, repeated, nightly assault on the endothelium by metabolic dysfunction, oxidative stress, and inflammatory damage that the body then attempts to repair using, yes, cholesterol. The cholesterol arrives like a patch on a damaged wall. If the damage stops, the patch holds and the artery heals. If the damage continues night after night, year after year, the patches accumulate, calcify, and eventually narrow the artery to the point of crisis. The technical name for this process is endothelial dysfunction, and it is the actual root cause of cardiovascular disease. Research published in the New England Journal of Medicine and the European Heart Journal has been documenting this for over 2 decades. The conversation in cardiology has shifted significantly, and yet at the primary care level, at the level where most patients receive their information, the story remains the same as it was in 1985. Eat less fat. Lower your cholesterol. Take a statin. The script has not been updated because the script generates an enormous amount of revenue. Now, here is where things get critical, and here is what every viewer needs to hear, regardless of age. The cholesterol-lowering medication industry generates more than $30 billion annually. Coronary stent procedures generate billions more. Bypass surgery, cardiac catheterization, lifelong cardiology follow-up, all of it represents one of the most profitable sectors of modern medicine. There is no billing code for teaching a patient how to support their endothelium overnight. There is no insurance reimbursement for explaining circadian metabolic patterns. The 15-minute appointment cannot accommodate the conversation, and so the conversation does not happen. How old are you? Write it in the comments below. There is a reason for asking. The patterns described in this video affect different age groups in different ways, and knowing the audience demographic directly shapes the future content of this channel. Whether someone is 45 and still has full ability to reverse this process, or 75 and needs a more cautious approach, the answer matters. Now consider the case of Margaret, a 64-year-old retired school teacher who came to the clinic 3 years ago carrying a folder of test results. Her total cholesterol was 248, her LDL was 156, and her physician had placed her on a statin 2 years earlier. She was doing everything right by the conventional metric. She ate oatmeal every morning. She avoided red meat. She walked her dog 3 times a week. And she was terrified because despite all of this, she had begun experiencing chest tightness when she climbed stairs, a sensation she described as a band squeezing across her upper chest. A coronary calcium scan revealed a score of 312, indicating significant arterial calcification. Her cardiologist recommended a catheterization and likely stent placement. Margaret asked for time to consider. She came to the clinic for a second opinion. The conventional numbers were not telling the real story. What the conventional numbers missed was her fasting insulin of 19, her hemoglobin A1C of 5.9, her triglyceride to HDL ratio of 4.2, and her habit of eating her last meal at 9 p.m. every evening before going to bed at 10:30 p.m. Her arteries were not being damaged by her oatmeal. They were being damaged by 12 hours of nightly metabolic inflammation she did not know was occurring. Over the next 4 months, Margaret implemented the protocol that the rest of this video will describe in complete detail. She did not stop her statin without supervision, and that is critical. Anyone currently taking a prescribed cholesterol medication should not discontinue it based on this video. Any changes to prescription regimens require direct conversation with the prescribing physician. Margaret worked with her doctor throughout the process. By month 4, her fasting insulin had dropped to 8, her A1C to 5.4, her triglycerides had fallen by 41%, and her chest tightness had completely resolved. A follow-up calcium scan 2 years later showed her score had stabilized. The progression had stopped. Now, before describing the protocol, there is something every viewer must understand about emergency symptoms. The information in this video supports long-term cardiovascular health. It does not address acute cardiac events. If anyone experiences sudden crushing chest pain, pain radiating into the left arm or jaw, sudden severe shortness of breath, cold sweats accompanied by nausea, or a sudden sense of impending doom that requires immediate emergency services, call for emergency transport. Do not drive. Do not wait to see if it passes. Do not finish watching this video. Those symptoms indicate a possible heart attack in progress, and minutes matter. The same applies to sudden one-sided weakness, facial drooping, difficulty speaking, or sudden severe headache, which indicate possible stroke. With that understood, here is the complete protocol for protecting the endothelium overnight, the hours during which most arterial damage actually occurs. The first intervention is the timing of the final meal. This single change has more impact on overnight endothelial health than any other modifiable factor, and it costs nothing. The last meal of the day should end at least 3 hours before sleep, ideally 4. For someone going to bed at 10:30 p.m., the last bite of food should occur no later than 7 p.m., preferably 6:30 p.m. The reason is precise and physiologically grounded. Digestion elevates insulin for approximately 3 hours after a meal. Insulin in the bloodstream during sleep prevents the body from entering its natural overnight repair state, during which the endothelium regenerates and inflammatory markers decline. Eating late forces the cardiovascular system to remain in a low-grade inflammatory state throughout the night. The composition of that final meal matters as well. A plate built around 150 to 200 grams of non-starchy vegetables such as broccoli, zucchini, leafy greens, or cauliflower, combined with 100 to 150 grams of protein from fish, eggs, or a small portion of poultry, and 15 to 20 grams of healthy fat from olive oil, avocado, or nuts, produces minimal overnight glycemic disturbance. A plate built around pasta, rice, bread, or sugar produces hours of elevated blood sugar and insulin while the person sleeps. The difference between these two dinners, repeated nightly for years, is the difference between healing arteries and damaged arteries. The second intervention is overnight hydration management. Blood thickens during sleep because no water enters the body for the duration. By 4 a.m., blood viscosity has increased measurably, which is one reason heart attacks occur more frequently between 4 and 6 a.m. than at any other time of day. The protocol is simple. Drink 250 milliliters, approximately 1 cup of room temperature water 30 minutes before bed. Place a second glass of 250 milliliters on the nightstand. If a person wakes during the night, even briefly, take 3 or 4 sips. In the morning, before coffee, before food, drink another 350 to 500 milliliters of warm water. This 3-stage hydration protocol keeps blood viscosity within healthy parameters across the most dangerous overnight hours. The third intervention addresses the evening meal supplement that supports endothelial repair overnight. With dinner, consume 1 tablespoon, approximately 15 milliliters, of cold-pressed extra virgin olive oil. This is not a fad. The oleocanthal compound in genuine extra virgin olive oil exerts an anti-inflammatory effect on the endothelium that has been documented in research published in the journal Nature and confirmed in multiple subsequent studies. A meta-analysis in the New England Journal of Medicine on Mediterranean dietary patterns demonstrated a 30% reduction in cardiovascular events among participants who consumed approximately this amount daily. The olive oil can be drizzled over the dinner vegetables. It does not need to be consumed separately. The fourth intervention involves a specific evening compound that supports overnight endothelial function. 1 to 2 cups of hibiscus tea, prepared from 1 tablespoon of dried hibiscus flowers steeped in 250 milliliters of hot water for 10 minutes, consumed between 6 p.m. and 8 p.m. has been shown in research published in the Journal of Nutrition to lower blood pressure measurably and reduce oxidative stress markers. For anyone currently taking blood pressure medication, this is important. Hibiscus may enhance the effect of antihypertensive drugs. Monitor blood pressure carefully and consult with the prescribing physician because dosages may need adjustment as the body responds to these combined interventions. The fifth intervention is the most underestimated of all. Sleep position and sleep quality directly affect overnight cardiovascular stress. Sleeping on the left side reduces pressure on the inferior vena cava, the large vein returning blood to the heart, and improves overnight venous return. Elevating the head of the bed by 10 to 15 centimeters, approximately 4 to 6 inches, using risers under the bedposts rather than stacking pillows, reduces overnight reflux, supports better breathing, and reduces nighttime blood pressure surges. For viewers who snore loudly or who have been told they stop breathing during sleep, this is a separate matter that requires evaluation for obstructive sleep apnea, a condition that dramatically accelerates endothelial damage and must be assessed by a sleep specialist. The sixth intervention is morning. Within 30 minutes of waking, perform the following sequence. Sit on the edge of the bed for 1 full minute before standing. The reason is that rapid standing in the early morning, when blood pressure is naturally surging, places acute stress on a cardiovascular system that has not yet fully transitioned to wakefulness. After standing, drink the 350 to 500 milliliters of warm water previously described. Then perform 5 minutes of slow walking through the home before any other activity. This gentle activation reduces the platelet stickiness accumulated overnight and helps blood viscosity normalize before the demands of the day begin. Now here is the complete daily schedule that brings all of this together. Upon waking, sit on the edge of the bed for 60 seconds, then drink 350 to 500 milliliters of warm water. Walk slowly through the house for 5 minutes. Eat breakfast within 1 hour, built around protein and healthy fats rather than refined carbohydrates. An example is 2 eggs cooked in olive oil with sautéed spinach and half an avocado. Coffee, if consumed, comes after the water, not before. Through the day, prioritize movement every 45 to 60 minutes, even if only for 2 minutes of walking or simple standing stretches. Sitting for longer than 90 minutes at a time produces measurable endothelial dysfunction in healthy adults within a single session. The remedy is simply interrupting the sitting. Total daily walking should reach a minimum of 6,000 steps for individuals over 60 and 8,000 for those under 60, accumulated however suits the day rather than completed in a single block. In the afternoon, between 2 and 4 p.m., consume 1 serving of a polyphenol-rich food. Options include 30 grams of walnuts, a small handful of blueberries, 20 grams of dark chocolate at 85% cocoa or higher, or a cup of green tea. These compounds directly support endothelial function and reduce oxidative damage to arterial walls. Dinner ends at 7 p.m. or earlier. The plate composition follows the structure described above. With dinner, the tablespoon of extra virgin olive oil over the vegetables and 1 to 2 cups of hibiscus tea between 6 and 8 p.m. Evening from 8 p.m. Until bedtime, avoid all food. Sip water as desired. 30 minutes before bed, drink 250 milliliters of room temperature water and place a second glass on the nightstand. Elevate the head of the bed if not already done. Position the body on the left side when settling to sleep. This is the complete protocol. There are no expensive supplements required. There is no specialized equipment. The total daily cost of these interventions is essentially zero beyond the food a person was already going to eat, with adjusted timing and composition. Yet research consistently shows that protocols of this nature, applied with discipline for 3 to 6 months, produce measurable improvements in endothelial function, inflammatory markers, fasting insulin, and triglyceride profiles, often substantial enough to reduce or eliminate the need for some medications under physician guidance. What should be expected on this protocol, and on what timeline? Within the first week, sleep quality improves noticeably. Most people report waking less frequently during the night and feeling more rested. Within 2 to 3 weeks, morning blood pressure readings, for those who measure them, typically decrease by 5 to 10 points systolic. Within 4 to 6 weeks, fasting blood sugar and energy levels through the afternoon become more stable. Within 3 months, lipid panels generally show reduced triglycerides and improved HDL, with the triglyceride to HDL ratio, a far more meaningful marker than total cholesterol, often dropping significantly. Within 6 months, for those who repeat coronary calcium scoring, progression typically slows or halts. Reversal of existing calcification is rare in any protocol, but stopping further damage is achievable and dramatically reduces cardiovascular event risk. A critical word about scope. This protocol applies to adults concerned with cardiovascular prevention and metabolic optimization who do not have acute or unstable cardiac conditions. Anyone with unstable angina, recent heart attack, recent stent placement, severe heart failure, or significant arrhythmia requires individualized cardiology guidance and should not implement changes without direct coordination with their cardiologist. Anyone with type 1 diabetes requires special attention to the meal timing recommendations, which may need modification under endocrinology supervision. Anyone taking blood thinners, antihypertensives, statins, or diabetes medications should communicate with their prescribing physician before and during implementation, because the effectiveness of these interventions often means that medication dosages need to be reduced over time, and this adjustment must be medically supervised. Never stop or reduce prescribed medication independently. Here is the truth that the cardiology establishment will not deliver in a 15-minute appointment. Heart disease is not primarily a cholesterol problem. It is a metabolic and inflammatory problem that damages arteries over decades, primarily during the overnight hours when the body should be repairing itself, but instead is being asked to manage residual food, elevated insulin, dehydration, and inflammatory burden. The conventional approach of lowering cholesterol with medication while ignoring all of these underlying drivers is like repainting a house while the foundation is cracking. The paint may look fine. The house is still failing. Every person who implements even half of these interventions consistently will reduce their cardiovascular risk substantially. Every person who implements all of them with patience and discipline over 6 to 12 months will alter the trajectory of their cardiovascular health in ways that no medication alone can match. This is not theory. This is documented physiology, repeated in study after study, ignored by primary care medicine because there is no profit in teaching people how to sleep, eat, and walk. If this information has been valuable, subscribe to Dr. Waterling, hit the like button, and share this video with someone who needs to hear it before their next cardiology appointment. A spouse who eats dinner at 9 p.m. A brother who has just been told his cholesterol is high. A parent who has been on a statin for 15 years without anyone explaining what actually damages arteries. Sharing this video may be the most important thing a person does for someone they love this week. And as a reminder, write the current age in the comments below. The patterns described in this video evolved through different decades of life, and the comments shape the direction of every future video on this channel. The mission is simple. Reach people with the information the system will not deliver before that information arrives too late. The arteries are listening tonight. What happens between 10 p.m. and 6 a.m. determines more than almost anything else how many healthy years remain. Sleep well, eat early, drink water, and remember that cholesterol was never the enemy. The enemy was the silence around what actually causes the damage. That silence ends here.